Hi, this is Stacy Gardner, and this is my research proposal presentation for Counseling 515. For my proposal, I am interested in those with eating disorders and how they've been affected since the onset of the coronavirus pandemic. So the problem and the research has indicated that COVID-19 pandemic has resulted in increased isolation, which has then led to an increase in mental health challenges. So people are staying home more, they're now working from home more, they are going out less, there's far less socialization. There has been some early research on the effects of the pandemic on those with eating disorders. What I am particularly interested in, however, is those who reside by themselves, without roommates, without a spouse, without family, and whether or not their symptoms have changed since the onset of COVID-19. So my hypothesis is that those who live alone experience an increase in eating disorder symptoms after the onset of COVID-19 pandemic. The null hypothesis states that there's no change in eating disorder symptomology since the start of the pandemic. For the method, my sample will come from an outpatient eating disorder clinic using patients who have a diagnosed eating disorder per the DSM-5. So these patients are and have been a outpatient of this eating disorder clinic. The inclusion criteria are those who identified in their demographics as living alone, and the exclusion criteria are anybody who indicates that they live with a family, roommate, spouse, etc. The instrument I propose to use is the Eating Disorder Diagnostic Scale, or the EDDS. Research has indicated positive reliability and validity using this instrument. And the reason I'm using it is it is easy, it's quick to use, it's only 22 questions. It's a combination of Likert questions, yes, no responses, and also free space for responses. It uses ordinal, nominal, and ratio data. The EDDS scores are a summation of the responses, so the higher the score, the more severe the eating disorder is. The participants will take the EDDS 7 months into the COVID-19 pandemic. I will then take their scores from their current 7 months into the pandemic and compare it to their most recent pre-pandemic EDDS scores. For the analysis, because I'm looking at the same subjects over 2 different periods of time, I'm going to use a paired t-test to see if there is changes in the scores, whether or not they are statistically significant or not, pre-pandemic versus post-pandemic. A p-score of less than 0.05 will indicate statistical significance against the null. If there is statistical significance, if there is a difference, to reject the null, meaning there's no change in eating disorder symptomology, I will then need to determine if the scores are higher pre-pandemic versus 7 months after the start of the pandemic to accept my hypothesis. As for the implications from this research, this can help counselors with developing and implementing interventions to reach out for the specific demographic of clients with eating disorders, those that live alone without as much social support as those that may have roommates or family living in the same house. As far as Christian integration, a lot of what this comes down to with this isolation and increased mental health setbacks comes down to loneliness. So the Bible speaks to loneliness. Isaiah 41:10 states, "Fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you. I will help you. I will uphold you with my righteous right hand." That is my research proposal. Thank you so much for listening.